Los Angeles boasts one of the premier rehabilitation centers in the nation in Rancho Los Amigos National Rehabilitation Center. Their approach to treating patients is ever evolving, and now patients who have suffered neurological trauma will soon get help from a robot. I'm your host, Rachel Bozing. Welcome to My County, the show that explores services and programs provided to you by Los Angeles County. Joining me today is Dr. Mindy Aisen, the Chief Medical Officer for Rancho Los Amigos National Rehabilitation Center. We'll call it Rancho from here on out. You've been in business and helping patients for 50 years, and you have tremendous expertise in this field. Give the viewers an idea of what I'm talking about.
Well, certainly on the West Coast, Rancho was the first and has been in an enduring way the most outstanding rehabilitation facility. We have intensive care unit care, acute medical care, and acute rehabilitation and outpatient rehabilitation care. Our clinicians are plastic surgeons, intensivists, physical medicine experts, neurologists, internists with expertise in diabetes, hypertension, rheumatology, you name it.
And just to give people an idea of the scope, your inpatient number is about 3,600 annually and outpatient about 70,000 people annually. So you really are helping a lot of people in Los Angeles County. And while you were talking about things like spinal cord injury and trauma, the bulk of your patients have suffered some sort of neurological trauma. Tell me about that, what that means, first of all.
Well, most rehabilitation facilities serve people with neurological conditions. Okay. Greater than 50% have neurological conditions, stroke, traumatic brain injury, multiple sclerosis, spinal cord injury, amongst other neurological conditions.
Now, back in the day, there was a kind of a school of thought that initially possibly the brain wouldn't recover in a way that we think so now. Tell me about how the school of thought around brain recovery's capability used to be and how it is now.
Not that long ago, even in my lifetime as a resident, we were taught that structural damage was destiny, and that once a stroke had happened or brain injury had happened, rehabilitation might make someone more comfortable, might keep the limbs more limber, but it really wasn't going to promote genuine recovery. And in the 90s and now, we have realized that there's great capacity for plasticity in the human brain, even the aged, injured brain.
And what that means when you're talking about brain plasticity, you've also figured out kind of a way to approach that in terms of the intensive, it has to be fun. Illuminate that for us a little bit.
Well, it's the kind of the old adage that practice makes perfect. And we know that people like musicians or athletes can hone human performance by intensive practice. And that practice has to be meaningful, and it has to elicit joy in the brain. And we now find that intensive practice that's truly fun and meaningful for someone who's developed paralysis can lead to genuine neurological recovery.
Now, the great thing is that you're about to introduce a robot into the rehabilitation process for some of these folks who've had a neurological damage. It's the Manus robot. Tell me what it is and what you hope to achieve with it. You're really going to get intensive work with it.
It's exciting because we are the first facility on the West Coast to have this robot. This robot has been tested throughout the country in the VA and in other academic centers to examine recovery after stroke, and it's shown a great impact on recovery after stroke.
So what happens with the robot is that it can sense movement that the naked eye can't see, which I think is amazing. And you said that the robot has kind of three great things going for it. Talk to me about that.
Well, it's interactive, so it does sense movement before the human therapist or doctor can see it. And it encourages the person to move in the appropriate direction, so there's a biofeedback component. It's also hooked into virtual reality kinds of video games that we can make age and interest appropriate. So as the person starts to move an icon around the screen, they enjoy it, they want to do more. The more they do, the more the robot lets them do and encourages them to do. And so it's a very intensive, individualized motor practice session that engages pathways that are very pleasurable to the person doing it.
Now, one of the benefits that you were saying with the robot is that, first of all, you're going to use it for 5 or 6 people a day, right? This robot is going to be used pretty much 24 hours a day once you get it, and that you were talking about that it might be a 3-hour therapy per person per week. And the robot, one of the benefits is that it can do something intensively that maybe a human wouldn't be able to help another human do in terms of a rehab therapist.
Right, because it can perceive movement that the human therapist can't perceive, it may be able to more accurately direct movement. It also doesn't get tired.
Right.
It doesn't have a bad day. So it can give a very intense and repetitious experience that's tailored to the person. And ultimately, we think we can have several robots overseen by one therapist. So it may be a more efficient way to give better therapy.
And the other thing is that you're going to do some research with this robot too?
Yes. One of the populations we really want to serve more are the people with developmental disorders like cerebral palsy. And in fact, we're getting the robot because of a generous Los Angelino who wanted children of LA County to have access to this kind of technology. Children have an even more plastic brain, and we've begun to see that they have children who cerebral palsy is brain damage to an otherwise normal brain before the age of 2. So it's basically the baby with a stroke.
Right.
So if it works for the adult with a stroke, the thinking is it will be even better for a child with that kind of brain damage.
So then your plan is initially to address children and then to move on?
Yes, we're going to start with cerebral palsy in children, and then adults with cerebral palsy, and then extend that into the stroke population that's already, there's already good evidence for them benefiting from it. So the robot does have flexibility in terms of age use, size of the person, and it's got flexibility in terms of the kinds of video interactions that people are involved in, so that it's fun for whomever's doing it. For the 2-year-old little girl, it may be coloring, and for the adult, it may be a maze.
This is so exciting. Now, if somebody wants to hear more about it or they want to learn more about Rancho in particular, what do they need to do? Tell us.
They can come to our website, which is rancho.org, or they can call, which is 562-401-7161.
Dr. Aisen, thank you so much for being with us here today. And be sure to join us next time right here on My County, where we explore more programs and services brought to you by Los Angeles County.